Good afternoon, everyone. I hope you had an excellent lunch break and that you didn't have so many carbs that you'll fall asleep. There are many treatments for sleep apnea besides the ones that most people know, which is CPAP, and I'm going to go through that. And also some stumbling blocks, not just for patients, which is obviously why we're here, but I'm going to speak a little also from the provider point of view. We have some stumbling blocks going on as well. So, past, present, future. In the past, there was nothing other than an angry spouse and an elbow, maybe, to knock the spouse out of a snore. And then CPAP came along, and it was the Darth Vader mask, and that says, "I'd rather die prematurely than wear my CPAP mask." Thankfully, we've made a lot of progress since then. The problem is there are still a lot of people out there who look at CPAP and think about that picture and say, "I'd rather die." So we need to educate those people, and it's really a matter of educating not only the patient but also the bed partner that they are going to die if they don't treat it. So what we attempt to do as providers in the sleep medicine world is to customize a treatment. Before we said form and function, day one of medical school, blending those two things together on each individual patient, blending how the body works along with how it's shaped. So the reason for the beautiful picnic here is that when you have sleep apnea, you have to think way in advance of anybody else about the tools that you need in your picnic basket. Before you go out of town, you need to know, is there going to be a plug next to the bed? Is there going to be the right adapter if you're going out of town? Are you going to be on an airplane for a long time where you need a battery backup? Are you going to maybe just need your oral appliance and a little backup just in case? So it's mindful, and we need to think about it. It's very doable, but it's a lot of work, but it's doable, and we have to customize this. One size might fit most, but not all. We are shaped differently. I can't stress that point enough. Every person in this room who has sleep apnea has a little tweak on a tool or a device that might work for them, but it may not work for their neighbor. My plug for my ENT colleagues is that the airway begins in the nose. Air has to go through the nose, maybe the mouth, to get down to the lungs so they can do their job. Oxygen is life. Oxygen has to get in. We have the gamut of things to help treat sleep apnea. There is no such thing as a perfect pill. I know there are some pharma people out here. That's your job. Try to find one. Try to make one. There is currently no perfect pill that you can take that will restore and give you every single stage of sleep that you need to be healthy and well. Everything has a side effect. We're getting better, but that perfect pill does not exist. And there is a surgery that fixes all upper airway obstructive sleep apnea, and it's called a trach. Nobody wants a hole in their neck. Nobody wants a trach, but there is a surgical cure. The answer lies somewhere in between: pills, devices, surgery, and combos. Some of the diverse treatments that people do, and often I think Adam said that a lot of times you need a blend, you need more than one thing. There are several, I'm going to show some slides of a couple of these things a little later, but suffice it to say there are several ear, nose, and throat surgeries that start in the nose, going through the throat all the way down to the neck. Behavioral treatments, including weight loss and exercise. It was an old paradigm where people would just say, "Oh, just lose weight and you'll get rid of your sleep apnea." Not a thing. There are so many people who have sleep apnea who are not even overweight. So it might be a part of the journey, but not the whole thing. Devices, CPAP, APAP, BiPAP. There are oral appliances. Lots of sleep dentists are helping a lot of patients. Positioning apparatuses, Provent and Theravent, those are some nasal devices. A chin strap, sometimes that's all you need, is something to hold your mouth closed. Respitec is a device that holds the nasal valve open by sitting in your nose. And then there are medicines. Some people say, I just spritz my nose with a couple, decongestants or things and I'm better. Allergy pills and allergy shots. There's a differentiation to be made between treatments for sleep apnea versus treatments for sleep. Some people have insomnia or other issues, behavioral reasons why they can't sleep. For those people, things like medications, meditation, cognitive behavioral therapy, sleep hygiene, allergy, and nutritional changes. That's not necessarily specific to sleep apnea, but a lot of people have comorbid sleep problems when they have sleep apnea. And this is an awesome treatment. I don't know if anybody here knows what this is. This is called a didgeridoo, and it's an instrument that actually is a treatment for sleep apnea, because what it does is it strengthens the pharyngeal muscles. So if you can increase the muscle tone in those muscles that are collapsing when you're asleep, maybe it helps keep your airway open. So this slide was just a potpourri, and there's nothing specific about a product that I endorse. It's just I went on the internet and I said, show me some pictures of some CPAP masks and devices. So the bottom line is there are a lot of them. The real story here is if you're a sleep apnea sufferer and you're not happy with your equipment, call your home care company because they have access to all of these things, and you got to be a squeaky wheel and get them to give you the tools that might help you. Lots of things to try. There are some non-CPAP options. Again, there's nothing that's perfect. These are just some things. There's the Provent device that sits in the nose. You breathe in freely, and as you breathe out, there's an air column that holds open the back of the nose, and it works great for some people. There's an oral appliance there. There is a positioning pillow, like a sumo wrestler belt on the bottom. What's not on this slide is actually a tennis ball. That's the old-fashioned treatment, just putting a tennis ball in your nightshirt so you can't lie on your back. That's the Respitec on the bottom right. And then there are these pillar implants. There was a whole wave of time where there was a surgical implant device where if you stiffen the palate, it was thought that you would cut down on some of the snoring and maybe some of the mild apnea. It's really important that I show this slide as an ear, nose, and throat doctor because these are some of the things that are completely being missed on a lot of patients who come to me. And they've already been, as some of your journeys have taken you, to other doctors' offices. And this is anatomy that's just fixable. So the top left, that's tonsils. Those are just in the way of your airway. That person is fixable surgically. The one below it, it's a nose that's loaded with polyps. It's all swollen. There is no way that a nasal mask is going to work on that patient. The middle one has there's a lesion on the back end of the uvula. If you don't look with the right tool, you're never going to find it. The middle one, those are vocal cord polyps. Air can get down through your nose and your oral cavity, hits that vocal cord, those are flopping in the breeze. That person is going to have sleep apnea, needs a surgery. And then there's a big tongue. Some people are doing some tongue reductions to take down some of the volume of tissue. Separate slide here for a deviated septum because people talk about this, and I don't know if they know exactly what it is, but if you see the S curve there on that septum, that left nostril is totally blocked. Air cannot get in there. Well, guess what? That's fixable. That's a surgery. My colleagues and I, we can fix those things. That's great. Turbinates that are big, we can fix them, shrink them down, allow the air to go in. Endoscopic sinus surgeries work great. And one of the little underreported side effects of having sinus surgery or the balloon sinuplasty, opening up the sinuses, is that people say their sleep got better. We're not talking as an academy from the sleep people to the ENT people. We know we're helping sleep, so we should get that data together and get more people on the table if it's appropriate. New stuff is coming along. The FDA is approving things. This is a blend. This is a surgery and a device, a hypoglossal nerve stimulator. The early reports, if you are the appropriate candidate, it's a little strict right now, but there are some really happy patients. So, this is an exciting time to have new options. Stumbling blocks and minefields. Okay, so it's not always, now I'm going to, as a provider again, it's not always the doctor's fault. Sometimes it's a patient's fault. Sometimes a patient doesn't want to hear that maybe they have a problem. So, it's kind of difficult as a doctor. We're talking sometimes on deaf ears. And what I like to do is if I have that conversation with someone, I just document it. And I say, talked about it with the patient. I suspect the problem. Made myself available. I'm here for you. And then I hope that the lawyers won't come after me someday because the patient had a problem and I thought they did. You can't force a patient to get treatment. So it is a stumbling block. It's an attitude, and we all need to work on that. So these are a list, and it's a potpourri, and I'm sure more of you are going to add to this. There are a lot of missed diagnosis opportunities by providers, and I cannot speak for anyone else, and I won't. And I love my colleagues, and we're busy, and we do what we do. And sometimes if a patient comes in for one reason, we fix that one reason. And I don't know how responsible we have to make ourselves to fix everything. But I still try my best to ask the right questions, like the stop bang on every patient, and try to find as much as I can. Limited access to testing. Sometimes there's a backup in the sleep labs for weeks, months. I don't know. It's hard to get testing. Insurance companies, sometimes they say no, even though we give them all kinds of data. Home care companies are inconsistent. They don't answer phone calls sometimes. Patients are frustrated. I don't know. I'm just throwing these out there. Patients' preferences aren't heard. Maybe they told somebody they wanted a different mask and they never got it. Bed partner, I'm not sleeping with you if you're wearing that Darth Vader thing. I mean, that happens too. Poor education, comorbid medical issues, financial considerations. And I know that this group has a program to help people who have those, and that's awesome. And more of us should give that number out. So the picture of the ears on the door, I mean, as a patient, you need to go into a place where you're being heard and listened to. And talk to your friends who are successful, because they know they're charting a pathway that maybe we need to figure out who those providers are. My pet peeve, a lot of things what's being missed in a lot of patients who are on CPAP, or they've had an awesome surgery, you can drive a truck through their nose. What's missing? Allergies. Allergens in the bedroom that are contributing to nasal congestion. It could be the cat, it could be dust mites, it could be molds, it could be a laundry hamper that's got all the grass and pollen and stuff from outside. The other thing is, what are people eating that is adding to their inflammation? We talked about that before. Slow wave sleep, we talked about that. That's when the immune system repairs itself. If you're not having that slow wave sleep, your immune system is not repairing itself. There are other inflammatory conditions that just can act up at night. So you only get answers to questions you ask. So if you haven't been, ask an allergist. See if you can get to an allergist. And one more plug, clean your CPAP machines. A lot of hosing will have mold that starts growing in it if it's not cleaned. It's moist, and it is a breeding ground. I have seen people get terrible fungal sinusitis just from a dirty machine. So there are things you can do. We talked about REM before. I love it. We all need it. There are things that we're all doing that's robbing our REM, taking it away. And there are some medications that are doing that. Allergies do it, poor lifestyle choices, several medications that are very common. Alpha beta blockers, you can see the list here. And so be aware of what pills you're taking. And you might be safer not having so much REM, because if you're dangerous when you're in REM, maybe your doctor did you a favor by keeping you out of REM, but do you really want to be missing your dreams? I don't think so. So try to look up those lists. There are pharmacists and people on the internet. One little aside, a lot of people are on beta blockers, and just a pet peeve of mine too is a lot of beta blocker patients have insomnia as a side effect. Very easy to treat if you add melatonin, 3 milligrams, a half an hour before you go to bed. Beta blockers undo the melatonin pathway. So a little supplement. A lot of other reasons that people have fatigue. We talked about this before, and I kind of use it as a hook in my office to see if people are tired. And undiagnosed obstructive sleep apnea, that's why we're here. But sometimes people have fatigue because they're not getting enough sleep, or they're eating the wrong foods, or having anemia makes you tired, depression, hypothyroidism, diabetes. My favorite, dehydration. If you're not drinking enough water, you will be tired. Heart disease, allergies, chronic fatigue, fibromyalgia, you talked about that, and medications. So this is my final slide here, and my message that I'd like to leave everybody with is that the secret to a good night of sleep is a good day awake. And that means being mindful about how you're spending your day and making choices that are going to help you have a good night's sleep. Exercise, nutrition, activity, all of that. And then sleep is unconscious, and it will just come on, and you will restore and repair. Thank you.